Yesterday we have completed, I think, the important benign tumors, that is osteoma, osteoid osteoma, and then the important malignant osteoblastoma, important malignant tumors as sarcoma as well as that osteosarcoma. So I say just I impress upon again, you should know what is the exact age of the tumor, age of occurrence of that particular tumor. Next, what are the bones affected, usual and abnormal, and what are the sites of bones affected, usual and abnormal, and what are the findings of specific microscopic findings of the tumor and specific radiological findings of the tumor. The rest of the thing, the tumor may be having some special clinical feature and some kind of special clinical treatment. Otherwise, almost everything will be homogeneously equal, but you have to detect the particular point of the tumor, particular specific points in all of the following items that I have told, then it will be easier for you to remember. In addition to that, you should know the origin of the tumor if it is possible. So with that, we have completed the important tumors which are given on and often in the multiple choice questions. Now let us go to some topics which may not be on and often given, but sometimes it may be given. So on one such variety is chondrosarcoma. As like the benign counterparts, its benign counterparts are osteochondroma and what is called multiple osteochondroma as well as multiple exostosis. Multiple exostosis or chondroblastoma or enchondroma. So these three benign tumors may convert into the chondrosarcoma. Enchondroma, osteochondroma are the common tumors that may convert into the chondrosarcoma. Or sometimes the chondrosarcoma may arise de novo. De novo means by itself without any prior pre-malignant benign condition. De novo it can occur. So it can occur as a de novo as well as a secondary to such a tumors which I have already described, enchondroma as well as osteochondroma. So it is a cartilaginous tumor, less malignant than osteosarcoma, and it occurs in adulthood, whereas osteosarcoma occurring in the teenage group, the primary variety, it occurs in the adulthood. And most of this tumor is arising from the cartilage cells. By name itself indicate chondro means this one. The important character of this one, it will be occurring not only in the log bones but more in the flat bones. Mostly in the flat bone, and the appearance is a cauliflower-like appearance, and the tumor may not be visible completely until it is calcified. Unless it is calcified, it may not be visible completely. So now this is the one. Now the first. Working. So these. So in a nutshell of this chondrosarcoma, we will revise again as usual. Middle ages, 30 to 60, the bones affected mostly flat bones. Long bones are also affected, but mostly they are flat bones affected. Pelvis, sacrum, scapula, ribs, mostly flat bones affected. And then the microscopically they are malignant cartilaginous cells. Cartilaginous cells, how do you detect? It may show, the nuclei may be showing double nuclei, or a specific oval shape cartilage cell, a swollen shape of cell with a double nuclei. And then the special clinical feature of it is very slowly growing when compared with osteosarcoma. Osteosarcoma is a rapidly progressing, destructing tumor. It is slow growing tumor and it will take often long duration. Whereas in the case of osteosarcoma, pain then followed by very thin a few time it will be swelling. Now, X-ray appearance is a typical cauliflower-like appearance, cauliflower type of picture, which may be patchily mottled, blotchy calcification. Blotchy means it is not, it is like what's called patchy here and there and calcification. And then the treatment of choice is amputation or limb salvage according to the grade. You don't carry much meaning about blotchy, don't worry about that one, it is patchy calcification. That means that is the middle ages. Most of the time it is flat bones, that is common, pelvis, again scapula, scapular ribs, and the catchword for chondrosarcoma is girdle bones. The catchword for chondrosarcoma is girdle bones, the pectoral girdle bones and the pelvic girdle bones. Though they can arise into two ways. One, as usual, primary, that is a de novo, and the second one is from a pre-existing condition, a pre-existing benign conditions like exostosis, otherwise called multiple osteochondroma or enchondroma. The usual presentation will be hard lobulated mass because the cartilaginous tumor, most of the cartilaginous tumor are lobulated here. Appearance arising from the ilium or femur, that is about in the fourth decade of life. It is slow growing, pain and swelling often take long duration. The histological picture is showing, that is the typical histological picture. The focal you will see the endochondral ossification. You see, just like the endochondral ossification of a normal endochondral ossification, which is occurring in the normal when the bone, cartilaginous bone is being converted into cartilaginous model, being converted into a bone, the same stages, but in a rapid way. But the rapid endochondral ossification and then calcification, there is hypercellularity. That is almost typical of every malignant tumor, atypia and mitosis, every. But the important character here you have to see is the cartilage cells tend to be swollen and the double nuclei. Most of the cartilage cells or cartilage tumors will be having double nuclei. So the X-ray picture says it is at the corticomedullary junction. It is expanded at the corticomedullary destruction. It expanded, and at the corticomedullary destruction, it will destruct in the beginning cortex as well as medullary. Corticomedullary destruction, and then cauliflower-like appearance, and then patchy appearance of the calcification. Eccentrically situated, lobulated tumor with patchy calcification. Eccentrically situated, lobulated tumor with a patchy application. So the cartilage, the tumor may not be visible always. The tumor may be visible in the clinically, but because it is a cartilaginous tumor, you may see the outlines, but never see the actual picture of the tumor unless it is calcified. So that is about the another one or two pictures of this one. And let's see this one. That is the typically presented the girdle, pelvic girdle. And this is presented the what's called head of this one. Again you can see you are not clearly seeing the tumor. The treatment is surgical excision is the treatment, and response to chemotherapy and radiotherapy doubtful. So always it is preferable to have an amputation and a limb salvage procedure. How do you determine for what is called limb salvage procedure? What are the investigations you will be doing to do a limb salvage procedure? You don't want to lose the limb, you want to save the limb. Then what is your approach? How do you approach? First diagnosis of the tumor, first diagnostic tumor. Then the level of the tumor. The important thing is level of the tumor. That means at what level the normal bone and the tumor bone are bordered. The normal bone and tumor bone are bordered. That means what is called zone of transition, transitional zone. If you know the transitional zone perfectly, then you can plan. From that zone about 10 centimeters, you can have what is called a zone of what is called perfect zone. If you know it, then about 10 millimeter thing, you can have this way and this way, and then correct it and do the excision. So just chondrosarcoma. So the salient points are 30 to 60 years of age. Primary chondrosarcomas arise either to normal bone, Secondary chondrosarcomas arise in a pre-existing cartilaginous tumor such as enchondroma, and common flat bones such as scapula, pelvis and ribs, the girdle bones. These are the important MCQs that were given. Tumor has a wide spectrum of aggressiveness. This tumor, there are other points. The tumor have a wide spectrum of aggressiveness, maybe a low grade malignant to very high grade. Usually it is low grade, but sometimes some of the tumors may be having high grade malignancy. So in not only diagnose the chondrosarcoma, but you have to diagnose how much virulent it is. The grading also very essential in case of chondrosarcoma. Metastasis occurs through the blood vessels, commonly to the lungs, as in the case of osteosarcoma. And then tumor have a mottled calcification typical of cartilaginous tumor. Any cartilaginous tumor most of the time will have typical calcified appearance because it is calcified cartilage and then only it becomes bone. Chondrosarcoma, again the same things.